Hi, welcome everyone, and especially welcome Dr. Taher. Thank you for giving us an opportunity to host you here on the LiveMAST group. We're very honored to have you today with us. Before we get started, I just wanted to share with our viewers that we will be having a lucky draw, so please stay on until the end. It's a really exciting online tool that I found for the lucky draw selection. So as we keep, getting people join us on Zoom, I'll add their names, and Dr. Taher has very generously offered to send out 2 of his books completely free of cost to our 2 lucky winners today. With that said, Dr. Taher, you're someone who needs no introduction, but I will give it a go. You're a resurgent physician. You have experienced cardiac issues, cardiovascular disease. And after that, you completely took charge of your life. And I'm not going to steal your thunder because it's a beautiful story and I've been reading it in your book. So you've summited some really tall mountains, including Kilimanjaro, and you've ran several marathons, and you're just an inspiration every single time we talk. So I'm just going to hand over to you, Dr. Taher. I will keep admitting, people as they keep coming into this Zoom, and every time somebody joins, I just request you guys to put yourself on mute so that when Dr. Taher is talking, we're actually able to listen to him and his presentation. So thank you so much. Welcome, Durva. So nice to see you here. And Dr. Taher, would you like to share your screen and we get started?
Great. First of all, thank you, Nivi, for that kind introduction. And today being a Heart Awareness Month, so this is the right time to give me the opportunity to talk on this extremely important subject, South Asians and heart disease, the impending threat. So I'll start with my slide presentation. So I'm going to share my screen now. Okay, so here we are, South Asians and heart disease. Heart disease, mainly when I say heart disease, it is a coronary artery disease. The arteries that supply blood to the heart, and the heart then supplies blood to the rest of the body. This is the leading cause of death in the US, India, and worldwide for 103 years in a row. It kills more people than it has done in COVID or all the cancers combined, mainly the cancers of the lung, colon, prostate, and breast. Having said that, why is it that heart disease and South Asians are really in the mainstream of heart disease? Who are these South Asians? See, if you ask a South Asian, and these are people from India, Pakistan, Nepal, Sri Lanka, Bangladesh, and as far as you can say Bhutan and Maldives. If you ask them, they will always tell you that we know somebody who has had a heart disease or somebody who has died of a heart attack. So we are 25% of the world's population, yet we carry 60% of the world's heart disease. In the US, we are 4 times more likely to get heart disease than our Asian counterparts, like the Japanese or the Koreans or the Chinese. We also get heart disease, we South Asians get heart disease at a younger age. 25% of us die before we reach the age of 40. and 50% die before they reach the age of 55. So in India, heart disease doubled from 1990 to 2019. We are about roughly 1.2, 1.3 billion people. 45 million of these have heart disease, making India the heart disease capital of the world. Therefore, in the US, the American Heart Association said that being of South Asian descent is an independent risk factor for coronary artery disease. So look at this gentleman, a patient of mine. He is from Broomfield, Colorado. He's 53 years old. Just about 7 months back, he's originally from Nepal, South Asian, looks like us. And he was an avid mountaineer and a trekker. So he used to love doing this around the mountains in Denver. He used to get a little short of breath, and he attributed this to his age. Till one fine day at the Denver airport, he had severe chest pain, shortness of breath, and he was immediately taken to the emergency room, where they found that he was having a heart attack and had 7 stents put into him. So here we come with my story. I am 73 years old, a South Asian, going to be 74 next month. I have good genetics and bad genetics. My good genetics are my father was 82, my grandfather died at 103. I have bad genetics from my mother's side. My mother, sister, and my brother died before the age of 59. The main thing is not genetics, because genetics plays a part, but a small role. It is our lifestyle. It's our South Asian lifestyle. See, what is our lifestyle? What was my lifestyle? My lifestyle, all through my adult age, I loved unhealthy, rich food. Whether it is the standard American diet, very aptly called the SAD diet, or the standard Indian diet, full of processed foods and saturated fats and oils and ghee. Or it can be any other food, the Mexican or the Chinese. Now, the point is that I was a seafood eater, an SEE. I ate everything at sight. Trust me, you name it and I've eaten it. Then I was a couch potato. I did absolutely no exercise. And being an older first generation Indian coming to America, I think we did not ever know the meaning of exercise. We were working so hard, yes, that we were actually not listening to our bodies, and we hardly did any exercise or any healthy aspect of our life. So, and then I think that the third factor was the stress. You see, coming over and working long hours and paying scant attention to your health or your family and friends and keep on working was a very stressful life. Now, stress happens in everybody's life, but I did not know how to handle stress. So with this combination of stressful life, bad eating habits, and absolutely zero exercise, I was not surprised that heart disease came knocking at my door at the age of 56. When I had to have angioplasty, that means you open up your coronaries and put stents into it. In that, my plaques were so thick that they had to use a diamond edge drill to actually shave off the plaques. And in the process, I had a heart arrest, a cardiac arrest, and they had to shock me to revive me. Now, one would have thought that after all this, I would have changed my life. I did not. I continued the erratic life that I had of eating and no exercise, working. So what really happened was that I became depressed. I was angry. I was under denial. There were tormenting thoughts running in my mind. I used to have night sweats, being fatigued, tired. And all these manifested itself into physical symptoms. So bronchitis and sinus infections were yearly visitors. Then I had all these problems of chronic constipation and the infamous diverticulitis, perforated twice, landed up in the hospital for a long time, and were given IV antibiotics, led to mouth ulcers, which remained with me for a long time. And enlarged prostate, again being put into the hospital. So all these continue. And now I realize that again, not a surprise when my angioplasty and my stents failed. I had restenosis. So I was now in for open heart bypass surgery. This is a time, folks, that I had an inflection point, a reflection point. This is a time I had thought I had two options, either to continue this sedentary lifestyle and live vicariously through my children and grandchild, and just wait, be on the rocking chair like most of my heart patients, and wait inevitably for death. Or I could turn this setback into some kind of an opportunity. And as I was being led into the ICU, having this in my mind, I looked at the nurses and promised them that I would do a half marathon in a year's time if all went well post-surgery. They humored me, they smiled. I don't blame them. But trust me, my recovery was remarkable. I was on the treadmill on the third day. I took no pain medications at all. Pain was now a pleasure in comparison to the 5 years of emotional agony that I went through. So I decided. I took up sports. I had promised nurses, so I took up running. A guy, a sedentary slob, now started with 1 kilometer, walking, then jogging, then running. And trust me, it gave me peace, because somebody, I think Neil Carroll said once that running is, this thing of consciousness and awareness. And it made me feel good the slow steps that I was taking, the small steps that I was taking. And I loved running alone. A lot of people need partners. But to me, the birds chirping, the waterfalls, and it was like I was doing meditation and with motion. So I then, at 8 months after my open heart surgery, I did go over to Nashville and ran that first half marathon in 3.5 grueling hours. When I finished it, I was on top of Mount Everest. That is what I felt. After that, there was no stopping. I had now to face new challenges. I changed my diet, my way of thinking, meditation, yoga, the whole 9 yards. So I'm going to make a very important statement, and I want folks to please listen to this. This is extremely important. Had I known then what I know and understand about heart disease today, I would have looked for other options besides stents and surgery. I talked and met a lot of the gurus, the researchers, the doctors in the field of medicine. Dr. Dean Ornish and Dr. Esselstyn, both who have written books on how to not only prevent, but reverse heart disease. Michael Greger of How Not to Die fame, Colin Campbell, China Study and Folk Over Knives. I talked to him at length. Neil Bernard, who is from the Physicians Committee of Responsible Medicine, and our own Nandita Shah, who has written a beautiful book of how you can reverse diabetes in 21 days. See, all these folks believe very strongly, like I do, that all these chronic diseases like your heart disease, strokes, blood pressure, diabetes, certain cancers, high cholesterol, all these are man-made. They can be avoided. And all these are common factors like inflammation, oxidative processes, shortening of your telomeres, you have your gut bacteria gets disturbed, and finally an overdrive of your sympathetic nervous system. So in trying to understand why I made that important statement, you have to understand the mechanics of coronary artery blockages. So let's see. This is your cross-section of your coronary artery. Try to remember this. This endothelial cell, the inner lining of the coronary artery, and this inner lining of the coronary artery is present, endothelial lining is present in all your blood vessels in your body. So this produces a very powerful substance, nitric oxide, which keeps the artery dilated, protects the artery wall, and keeps the blood flowing smoothly in the lumen. See how a healthy artery looks? Okay, now, what happens when we have a rich, unhealthy diet? The standard American diet, as you can see over here, with all its fries and hamburgers and eggs and meat and carbonated sugar drinks, or you have a junk food, vegan or a vegetarian diet, as you see around here. Oils, processed foods, saturated fats, sugar. What happens? It damages your endothelial lining that produces the nitric oxide. So there is a cascade effect now. What happens is that the fibrin, the cholesterol, the calcium, now starts forming on the damaged endothelium. This plaque takes years to form, decades to form. But eventually, this plaque will keep on narrowing the lumen, reducing the blood flow. And when the blood flow is reduced to an extent that you start getting chest pain on exertion, we doctors call that as angina. So what happens when there is a plaque that is built on for a long period of time? You see, try and understand, there are new blood vessels formed. See, here is your blockages, right? Your coronary artery. Here is your new blood vessel forming. The new blood vessels which form go distally to your blockage so that supplies the blood, never having your heart to be devoid of any blood because it's constantly supplying with these new blood vessels. Let me give you an analogy of this. Say if you have a raging stream and you want to block it, you take bricks and stones and try and block it on either side of the bank and come in the center, but water will find its way under the stones, above the stones, sidewards to move forwards. And this is what has happened to people who have angina. In this case, there is very little chance of getting a heart attack. Now, what happens in a heart attack? There are younger, friable, soft clots. This is your normal. The soft clots that rupture suddenly. It may be less than 50% blocked, but if it is a soft, this is a recent scientific research has showed this. And they block a certain part of the heart. This is a heart attack, folks, when 50% die with the first heart attack, especially if you are younger and a South Asian. So what happens in this case? When you have a heart attack, you're taken to the emergency room, your EKG is done, your blood work is done. You know that you are having a heart attack, you're taken to the cath lab, boom, 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 the clots are removed, stents are put in, and if they fail, they do a bypass surgery. This is the right way to see how to prevent, the heart attack. This is a right way to actually treat a heart attack. My partners, both physicians, both Indians, one in his late 50s and one in his 60s, both had heart attacks with less than 50% of blockages. There were friable soft clots that broke. One had to have stents and the other one had surgery. What happened to me? I did not have a heart attack. My plaques were larger, thick, containing calcium, scar tissue, and sturdier, unlikely to break and cause heart attacks. Two of my arteries were 98 to 99% blocked. One was a widowmaker, but I did not get a heart attack. And when I show you the next slide, I'll explain to you why I would have thought of other options besides having stents or surgery. How do you prevent, and especially more so, reverse coronary artery disease? So here is this a miracle or can this actually happen? You can reverse coronary artery disease with your lifestyle change and diet. This is an actual patient of Dr. Esselstyn. In fact, he was his colleague, a doctor. and he had multiple blockages and multiple other problems. So he went to Esselstyn and said, I would like to be on your diet, the whole food, plant-based, no oil diet, less fat. And he was put on this diet. Look at his coronaries, which are moth-eaten, narrowed down. This was his coronaries prior to him being put on a whole food, plant-based diet. And in 2.5 to 3 years, without surgery, without the stents, look what happened to his coronary, dilated. What are we doing? When we do the stents and we do the bypass, we are destroying the endothelium. So here what we are doing is by that regenerating the endothelium. So whether you have a bypass surgery or a stent, or you go on a whole food plant-based diet, in all cases, you should be following a proper whole food plant-based diet, because your other endothelium in your blood vessels, in your brain, in your kidney and legs, they are all being saved by the whole food plant-based diet. So with this in mind is what I made my statement. Now to back up this is large international studies were done in New York and Stanford. What they said that invasive procedures like your bypass surgery or your stents are no better than diet, medication, and lifestyle changes, even in severe but stable heart disease. That is what I had, a stable heart disease. And Dr. John Cook, the cardiologist from Stanford, says that 50% of stents and angioplasties done in the US are unnecessary. So what are we doing? We physicians and doctors have a role to play. There are a lot of diseases, acute and emergency, and we need the consequence of the disease at that time. But we are treating the consequence of chronic diseases, like the blood pressure, diabetes, cholesterol, and what we should be doing is a lifestyle treatment. We should be treating the cause, and more so we should be doing things to avoid it, because this is man-made. But what are we doing? We are treating the consequence of this disease by pills, by medicines, by surgery. And so in my opinion, if you have an overflowing sink, what we doctors are doing is mopping the floor, so that we live longer, but not healthier. Then all you have to do is turn the faucet off by having a proper lifestyle change. So here we come. We are South Asians, and we have a tremendous amount of heart disease. General risk factors for all, whether you're white, black, Asian, or South Asian, Latino, high cholesterol, blood pressure, smoking, diabetes, obesity, the Interheart study said, these are all very risk factors for all. But the mediators of atherosclerosis in South Asians living in America, very aptly called the Masala study, took about, I think it was about 1,100 patients from the age of 40 to 84. And what they found was that we do not fall into a category of obesity in the Western terminology. We do not look obese, but we carry fat. And where do we carry our fat? We carry our fat in our bellies, a visceral fat which is directly responsible for heart disease. This visceral fat is there in your liver, around your heart, in your muscles. When a healthy fat is supposed to be just below the skin, the subcutaneous fat. So if you go to a South Asian country and you look around, you don't find people who are obese, but they have a little pouch, and that's visceral obesity. So if you look at the BMI that they do in a doctor's office, which is your height and your weight, you can Google it and you can get your BMI. The normal is 18.5 to 25, overweight is 25 to 30, obesity is over 30. That means I would have fallen through the cracks, because when I got my heart disease, this thing was normal. It was 23, my BMI. So the better way, so the thing is, cut these things down. Your normal BMI for South Asians should be 18.5 to 23. Over 23 to 27 should be overweight, and over 27 should be obesity. Better still would be to go for a waist circumference. When you find that not more than 30 inches should be your waist circumference in men, and not more than 30 inches in women. In my opinion, I think it should be less for South Asians. It should be about 33 and about 28 in women. So the other things that we South Asians have more of risk factors than others. One is insulin resistance. What is insulin resistance? See, insulin resistance is when you have blood, your sugar in your blood. What insulin does is takes its sugar to the cells to be utilized as energy. Now, if your cells are full of fat deposits, then that sugar comes back into the blood and rises the blood sugar. You get pre-diabetic, diabetic, and eventually you'll end up getting type 2 diabetes. We are prone to this. What they found was that in the second generation Indians who are very health conscious in terms of exercise, they do a lot of exercise, they don't look obese, but when they eat the junk food or the fast food or their mother's cooking at home of oil, they tend to be also insulin resistant. So folks, it is important that diet is much more important than exercise. Again, when they did angiograms, they found that we Indians tend to have smaller coronaries. The luminal diameters of our coronaries are smaller, meaning more likely to get obstructed. And also, we have got larger lesions, and we don't have one or two vessels, we got multiple vessel disease, coronary disease. High triglycerides and very low good cholesterol, this combination I have seen in practically every Indian that has like metabolic syndrome. This combination I've always seen, a high triglyceride and very, very low good cholesterol, especially the HDL2. Now, triglycerides normally should be up to 150, but I've seen people with 1,000, 5,000, and I've seen one gentleman with 10,000. When you have in thousands, this is what your blood looks like. This is a naked. eye that is looking at the blood. And this is a creamy cheese sauce-like. And you have good cholesterols, which are very, very low. My good cholesterol was 29, when minimum it should be 45. Now, I have about 10 to 12 patients, mostly women, who have their good cholesterol in their 90s. And I kid with them. I said, you may die of a common cold, but not of a heart disease, because a good cholesterol is like a garbage truck taking away your bad cholesterol. Again, we have a high coronary calcium content in our coronary arteries, which is, in effect, a harbinger of heart attacks and strokes later on. We have a higher metabolic syndrome. Do you realize that we have got about 1/3 of South Asians who have a metabolic syndrome? That is your high blood pressure, low good cholesterol, high triglycerides, high blood sugar, and the visceral obesity. And 17% of our women have a higher metabolic syndrome. We also have a separate independent risk factor, that is spilling protein in the urine. And we have a vascular inflammation, which is higher than the others, because the role of inflammation is the primary role in atherosclerosis and diabetes. There's a little test, the C-reactive protein, that you should always ask your doctor to get it done. And I found this CRP high in South Asians, especially Indians. Gestational diabetes. Our young women, when they get pregnant, they tend to have diabetes. And some of these carry on and become type 2 diabetes after they deliver. Sedentary lifestyle. I wish I'd known this earlier, but trust me, we Indians do not, we South Asians are still lagging way behind the others in terms of exercise. We got 1.3 billion people in India, and we get about 2 or 3 gold medals in the Olympics. Well, then you have your dietary habits. We South Asians love our refined processed foods, packaged foods, high in sodium, sugar, flavors, preservatives, artificial colors, saturated fats, trans fats, oil, ghee, and butter. No, we Indians have a cultural connection to oil. We feel it's a sign of warmth and generosity. So if you see and go and visit somebody's house, and if you're a pot of curry that does not have a layer of oil that is as thick as a Valdez oil slick, we think we are not doing justice to our guests. And in my own homes, also back in India, we use the oil repeatedly. That becomes carcinogenic and cause the heterocyclic amines that causes cancers. Then you have the sugary snacks. We love our jalebis and laddus and rasmalais, but this is going to affect you. This kind of a diet merged with the Western diet of meat, eggs, dairy, and pizzas and sweetened beverages is a time bomb about to happen. And then, of course, beware of trans fats. Trans fats is not allowed in the US, but I believe, I'm not 100%, but in India, trans fat is still allowed. So I've said all this, so what can we South Asians do to reduce our risk factors? I'm a South Asian. Most of the listeners over here are South Asians. What can we do? How can we stop our young ones dying at a young age or our older folks getting a heart disease? So what we do is, first of all, here are some things we can do. This is an ongoing study about why South Asians, we are still writing the book on why we are getting more heart disease. But so far, if you want to be helped, this is what you should do. And these are my personal observations, which I have noticed with my patients and I've talked to people around. Know as much of your family history and discuss it with your relatives and loved ones. You know, folks, we love to talk about our children getting into law schools and becoming CEOs and whatnot, but we rarely talk about our people dying young and our, our risk factors, our genetic history. Talk about it so that we can help each other out. Number two, beware of your risk at an earlier age, because remember, fatty streaks start at what age? 8 to 10 years. That is the age of my grandson. Talk to a doctor who knows the risk factors for South Asian community, because if they don't know that you are insulin resistant or your visceral obesity is different from the other Americans or other people around, then you're going to fall through the cracks. Now, coronary calcium scan or heart scan, in my opinion, should be done if you are over the age of 40, do not have any high cholesterol or blood pressure or diabetes, but still have a very strong family history, get a calcium scan done. This is where they do the calcium score, and if it is higher than this, then you will be asked to do other procedures. So I feel comfortable in telling my patients to get a calcium scan done if you're a South Asian and over the age of 40. Heart healthy diet. There are a few things to remember. You see, you either have the legumes and which are beans and lentils and all that. You have the grains, which are your barley, brown rice, millet, amaranth. You have vegetables, cruciferous vegetables. You have fruits, which are antioxidant and phytonutrients. And then finally, you have nuts, which have a lot of other things of necessary fats and calcium. What should one do? Look at labels. In my opinion, if you cannot pronounce the word in a label, don't eat it. Avoid junk vegetarian food. Remember, a junk food vegetarian or a vegan, if you are, it is as bad as putting a meat in your mouth. Reduce your bad cholesterol by avoiding or cutting back on meats and saturated fats, and also dairy products. In my opinion, dairy is the liquid meat. I think it was Rip Esselstyn who said that an ounce of meat is equivalent to a cup of 2% milk. Avoid trans fats, because these are vegetable oils that chemically altered to keep them at solid at room temperatures. Exercise. It is very important. I think every doctor should write a prescription of exercise for their patients. People come and tell me, oh, I've got osteoarthritis and I've got back problems. That's not going to kill you. but heart disease is going to kill you. 30 minutes of moderate exercise 5 times a week under stress-free conditions. And it should reach eventually. You start slow, of course, take baby steps, but eventually you should be able to do 70% of your maximum heart rate. And your maximum heart rate is 220 minus your age. So if you take me, who is about now 74, if you take 220 minus 74, it will be something in the vicinity of 140, 45. And then 70% would be about 104 and 105. If I don't reach this 104, 105 in my 30 minutes, then it is not cardioprotective. It may help you other ways. Endorphins, feeling good, classic. Now, number 2, it also helps in increasing your good cholesterol, because my good cholesterol was 29. It is today 56. In the long run, exercise decreases your heart rate so that muscles can pull oxygen for the cells from the blood without the heart doing more work. And it decreases your blood pressure. So heart healthy stress management. We have already talked about the diet. We have talked about the exercise. So let's look at what are the lifestyle, the 6 lifestyle pillars of healthy living. So the lifestyle pillars, 6 healthy pillars are, number 1, have a proper diet. Number 2, exercise. Number 3, have good night's sleep, at least 7 to 8 hours. Number 4, reduce your stress. Number 5, have a good social support. And number 6, avoid smoking or tobacco or excessive alcohol. Now, think about this. If you look at the first 2, exercise and diet, you take that out, then what happens is you have your stress and your sleep. These things, I believe, can be helped with meditation, spirituality, religion, yoga, and pranayama or sky breathing. It helped me. So because of the stress, I could manage diet, I could manage exercise. The stress level was what this helped me. Because remember one thing, when you have a stress level, there is a small little thing called amygdala in the brain. This amygdala sends out, and you have emotions of anything, sends message to the hypothalamus, which is a bandmaster in the body for endocrine glands. And this hypothalamus then sends messages. If you have a problem, an acute one, then it is your flight or your response, which would be fight or flight response. This is an overstimulation of your sympathetic nervous system. Perfect. Then it is like putting the gas pedal. Now when everything is over, then your stress is relieved. Now you put this thing on the brake and your parasympathetic takes over and everything seems to be normal. But if continuous stress keeps on, continuous emotions, stressful emotions continue, then you get the steroids, the cortisone levels coming up high. And now you are in the chronicity phase, in the chronic stress phase. This is harmful. And this is where your spirituality, your meditation, your religion comes into play. COVID and plant-based diet. Very recent, I heard Dr. Dean Ornish talk about this, that there was there was a study done of 3,000 people who were doctors and nurses in 6 countries, I believe. And what they found was one group was a heavy meat eating group and the other was a plant-based group. What they found in the plant-based group that they were 74% less likely to get moderate to severe COVID. And a heavy animal-based group, eating group, was 400% time more likely to get moderate or severe COVID. And this has been proven even by my son, who's a physician, that most people who come around and end up on ventilators and things are people who have chronic diseases that we talked about. 2 things more I would like to say. Even vitamin D. Please check your vitamin D. Even the best way to get vitamin D is sunshine. But if you cannot get sunshine during the COVID era or being too cold, then take a supplement of vitamin D. I've never seen anybody having overdose with vitamin D. And vitamin D does help in a lot of situations. It is not calcium that you need those supplements. It is vitamin D that helps to absorb calcium from your plants, so and other foods. So you need to get your vitamin D. Even before the COVID, I had the nursing home patients, 60% of the nursing home patients were vitamin D deficient. All you need to do is take about 2,000 international units of vitamin D. And remember, when you're out in the sun, it is the best way. It lasts longer, but it is not sunshine that is coming through your window panes, because then the ultraviolet rays do not help you in getting the vitamin D. So please check your vitamin Ds. When the COVID isolation was there, I remained home for 2 to 3 months and did my exercise at home. And I went to get my vitamin D checked. Normal is 30 to 100. My level was 6. Vitamin B12 is also a must if you are going on a whole food plant-based diet, because we did have vitamin B12 in the soil before. And we used to get the vitamin B12, but using pesticides and insecticides, we have the soil has not the soil cannot produce any more of the vitamin B12. In a way, it is good because we don't get dysentery and diarrhea. So please take a supplement of vitamin B12. Again, 2,500 units should be okay. Having said that, this is my book, The Open Heart, and I would like to, if people could really, really go on, because this is a heart healthy month, go over on Amazon and get your book. But I would like if people can put a review so that it increases the credibility of the book. And please pass this message all around. We have to, our main aim is to get our South Asians not dying prematurely of a heart disease. Thank you so very much.
Thank you so much, Dr. Taher. That was very insightful, very informative. You know, if there are any questions, we're now open for Q&A, and Dr. Taher can take questions. The only thing I would advise is that if you are struggling with chronic illness at this point and you have a question specifically pertaining to you know, medication, please refrain from asking that question. You may privately reach out, and if Dr. Taher is willing, he will be able to help you. But apart from that, we welcome questions. And Raj, Durva, yeah, you guys are here, so, and you know, please share your observations.
Come on, guys, I love questions.
Here, I'm going to get started. Thank you, Dr. Taher. Amazing journey that you've recently gone through, but I do speak to a lot of South Asians, and the biggest thing that I get with South Asians that are, older than 60, is, I've enjoyed my life, and as you said, hey, let me enjoy my time with grandkids. Do you think you are a little bit special, or can every South Asian do this? And what are besides changing diet, changing, getting exercise, what are the steps kind of mentally to help get on this pathway? Besides the knowledge that's out there, what are other blockages that people are facing?
You see, Raj, thank you for asking me this question. We all want to live longer, but we get scared of old age. You see, that's my point, that we want to live longer. And what medicine at this point is doing is making us live longer. So if you look at statistics, yes, we are living longer. But how are we living? That's my main problem, So if you have people of my age, 60 years, and if they even find that they cannot walk up and down the stairs without the help of something, then there's something wrong. Because I was in a worse situation than them. So they can take baby steps that I took. I'm not special, trust me. I still fall off the bandwagon at times. But I've reached a stage when my gut bacteria will tell me, hey, wait a minute, you did something wrong. And the next day is terrible. So I stopped telling people that, oh my God, you're going to live long, or you're not going to have the disease. What I really tell them is, try it out and see how good you feel.
Yeah.
If you're not going to feel good, don't do it. If you feel this is your lifestyle of staying in bed and on the couch and watching TV and you're happy about it and you don't have a problem. See, these people do not know what real health is.
Right.
They're living in a la-la land of feeling that this is the real health. Distension is normal. Their flatulence is normal. All this is normal. But once you find out, now I am not talking about longevity. What I'm talking about, the quality of life. Yeah, you may hear tomorrow, day after, or in months' time, or 2 years' time, or 10, and the Dr. Taher died. But hey, man, I lived my life. So that is what I'm trying to say. And if they have, it is our Eastern culture. What made my wife and daughter change? Because of animal cruelty. I changed for health reasons. But the moment I started putting this whole food plant-based diet in my mouth, I started realizing clarity of thoughts. I thought about the climate changes now. I thought about the animal cruelty. It is a fallacy to think, and that's why I'm talking about people who already have problems or don't have problems. You have to save your endothelium.
Yeah. Well said, Dr. Taher. We have another question from Pavitra. Your hand is raised. And if you're in a position to come on video, we'd love to see you on video as well. If not, it's fine.
Hi, Dr. Taher. This is Pavitra's husband, Karthik. She sort of tried to transform me. I had really high triglycerides, above 500, not quite 1,000 probably, because the instrument was not able to measure above 500. So, and she has been really concerned because I'm in my mid-30s, and she wanted me to do the whole food plant-based diet. Tried to do it for the last couple of years, and now the triglyceride levels are normal. I would say like below 150, like around 130. I've gotten here with I think her motivation and her cooking. I mean, no oil cooking and the whole food plant based. We're at a point now. I think, like you mentioned, the tension in our lives is always higher, right? I mean, we're always running after something like work related and other things. So being able to find the final piece of the puzzle is this inner peace where you talked about yoga, meditation, and other things. So how do you do that, and how do you not stress eat? Is the thing that I would want to get some advice from you.
Thank you for that question, and I wish all of us would have a wife like yours to help us out. I mean, I'm just kidding, but anyway, what I would really like to tell you is my own personal experience that you can be. I think I've talked this to Nivi before, that you can be lonely and depressed, and another aspect is you can be alone and happy. See, when I was depressed after that stance, I was lonely, I was depressed, I was miserable. I used to sit on a chair, look up at the ceilings, cup my face into my hands, have crying bouts, anger for no rhyme or reason. When I went to the yatra on foot on Mount Kailash, and when we did the parikrama, the Dolma Pass, which is 19,000 plus feet, at that time when they were high-fiving each other, I wanted to be alone. And I felt great just leaving that group and sitting on a rock and wondering, what is all this? Yeah, you have driven the best of cars, have lived in good homes, but is this the only thing? Is this the thing? There has to be a happy balance. Now, I am not asking listeners now or the recorded this thing that, okay, give up your material, these things and run after. I'm not saying that. A happy medium. Let's put it this way. I opened 5 clinics, but at what expense? At my job robbed me of an opportunity to lead a purposeful, positive life. I don't want that to happen to you. I can now relate and say point blank that if I could have done the same thing in a different way, I could have still opened the 5 clinics, but in a different way, whereby I would keep that separately. This thing, of course, everybody has to have the American dream. So I had a pursuit of American dream myself. I came late in my 40s. But what I did, I ended up with a reckless pursuit of fame and fortune. That is what I don't do. Everything that you do should be based on your feelings, on your beliefs, in the goodness of human beings. That is what. And reach the heights. Be CEOs, be CFOs, but be doctors, great doctors. But don't forget this basics. And this is our Eastern culture that has helped me on that. I was not like this. I didn't believe in all this. I believe late in life. I want you people to believe so that I can leave a legacy and say, wow, at least I did something in my older age. I hope I answered that question, sir.
Oh no, you did. No, it is very well answered, and I think, like you mentioned about the 5 clinics, that I think throws a lot of light because. Because we as youngsters, I think, want to push for the American dream between ages, I mean, like till you're 40, right? So I think your mid-30s, you're trying to push and say, hey, I need to get here by this age. I mean, you set these artificial deadlines, and sometimes it's you're adding more pressure to yourself, right? And at the end of the day, maybe there's multiple ways to reach the destination, but I think what you have mentioned is a sustainable way to get there. By not compromising your health is the right thing. So no, fantastic. Thank you, doctor. Yep. That's very insightful.
Thank you very much.
Thank
Go
you so
ahead.
much, Dr. Taher, for that great answer. And Karthik and Pavitra, thank you for asking. It's such an important question. And especially during the global pandemic, even if we're eating a whole food plant-based diet, we've sustained losses of different kinds. And there's a lot of ambiguous loss as well. People have been held up inside their houses, homes, in a lockdown. So inner peace is really important. And as I just mentioned in the chat, we will be sharing resources. There's an excellent resource called the polyvagal theory that was proposed in 1994 by Dr. Stephen Porges. It's nothing but the clinical interpretation of what happens to our autonomic nervous system when we breathe and when we do mindful and conscious breathing. So I will be sharing some of those resources. And I know that Dr. Taher has already mentioned about sky breathing or pranayama, which is part of our culture, and to delve into some of those resources that we have available, and we can understand them, because a lot of us understand, the language in which those have been written. It always helps. I see Gagan's hand is raised. Gagan, what's your question for Dr. Taher?
Hi, everybody. I actually, it's something recent that happened, but my question is about the family history. How much is, because my husband, he's not even 44. He's going to be 44 in April. And in about this was about January 31st, he had to be taken to the heart hospital, and they wanted to do the angiography, and angioplasty was done. They put a stent, telling me about that he has 99% blockage. When he had fixed his, I'm not saying like he fixed his diet 100% like me, but he fixed his diet up to, I would say, more than 60%. He was falling off the thing and coming back to the everything. But the doctor, when I told him, like, we don't use oils, we don't use any, he eats meat once in a while, nothing more than that. I mean, when he used to eat every day. When I told doctor about everything about my diet and everything, and he said possibly it was the change of diet maybe delayed it by a year or so. And my question, everybody's been telling me, doctors have been telling me, cardiologists told me, they said he has a family history. So it's inevitable. It's gonna happen. So you will have to be on the medication. They put him on like 4 different kind of medications for life. Like they said, they are the permanent medications. I know these can taper off according to what we have been doing for the past 3 years. I've been plant-based, and I've been, reading on it, and I've been talking to Nivi, and I've been like, being in this particular lifestyle, I know these medicines can taper off in few years or so, I believe. But why family history? I mean, if somebody changes the lifestyle, wouldn't that change?
Okay, excellent question. Gagandeep, right? Am I
Yes.
pronouncing your name properly?
Yes, Gagandeep, yes.
Gagandeep. Okay, excellent question. Just about 4 months back, I had 2 gentlemen. One was 49, one was 41, severe heart attacks. And I talked to their wives who were literally crying on the FaceTime. And trust me, that is what I say, younger people dying of heart attacks in South Asians, and having heart attacks, not dying, but still having and getting caught. Now, when you talk about genes, let me be very honest with you all. It is not that bad genes that run in your family. It is bad food. It's a bad diet. And remember, the genes are only 5 to 10% responsible for your health outcome. Most, and even this 5 to 10% can be mitigated or negated by a proper whole food plant-based diet and a lifestyle change. So I don't believe that that is there. Trust me, in my family, my brother and I are the only one who are alive, because nobody reached over 59 except for my father's side. So here I am with deadly genes. But what the whole food plant-based diet or the lifestyle, 6 lifestyle pillars, if you do that, then you are going to be a winner. And again, if you look at the site, can I mention this? I don't know, but the Desi low-fat, whole food, plant-based, no oil diet. That is amazing. So if you can follow that, trust me, tell your husband, but he has to follow this. He cannot be a meat eater once.
Yes.
That is very important, because if you know the game changers, they did that study on the erection of the penis and the ongoing listing of the erection. What they found with one heavy meat diet, there was a problem.
Yes.
So what my point is, again, same endothelium in the penile arteries. So you have to have a whole food plant-based diet with no oil and less fat. Am I following that? Remember one thing, I'm not using this as an excuse, but I have collaterals at my age. Your husband does not have collaterals. They start building, takes ages to build up. That does not give me an excuse to go and eat everything else. But I'm in a better state than your husband is.
Yeah, I agree. Yes.
So if he's going to do it, he has to go, he can do it step by step, giving up one, then taking another thing, whatever it is. I have no problems. But eventually he should be able to do it. Because he has got this, tomorrow he may get a stroke. The endothelium, you have not put a stent in his brain arteries. You have not put a stent in his kidney arteries. Genetics, you know, there's epigenetics now. That Nivi knows that epigenetics can change the way your genes work. Does not change your genes. I hope I answered your question, my dear.
Yes, yes, definitely. I am a firm believer. I've been researching on it and I've been talking to everybody. I am a firm believer that genetics can be changed with lifestyle. And only thing, as you talked about the movie Game Changer, that was the movie when we went to, when it came in theaters, we were the first ones to watch. We watched the premiere show when it came in the theaters. And that's when my husband started changing his lifestyle. And it did help, definitely it helped. Only thing, there used to be, people around, peer pressure, everything. I mean, going out with friends and, getting to know what exactly is going on. And he was basically under peer pressure. That's when he would be like, once in a while when he goes out for golfing or something, he would be eating whatever comes his way. So he loves meat. He definitely loved it all his life. He's a Marine, he's a US Marine. So all his life, he has been like that. And now it was very difficult for him to change, but he did make a change. I mean, I have, as Nivi knows, I mean, for the past more than 3 years, I haven't gotten any oil in my house, no sugar, no meat at all. And I'm trying to cut down on like several different things like gluten and other things that could cause problems. But I mean, right now, I don't have, if somebody comes to my house, I don't have milk in the house. I don't have eggs in the house. I don't have anything which used to be staple in the house. And, but still when he eats out, what he calls as a cheat day or cheat meal, I think that hurts him more than,
You
and
see,
then now this.
In my time, this was a bigger problem when peer pressure.
Yes,
And
it is still.
because see, at that time, we didn't even have restaurants having those kind of foods. In Atlanta, you've got 65 restaurants that can give you a beautiful vegan meal or a plant-based meal if you tell them not to use. So there is no reason for us not to do it now. Little advice I can give is if he's going out to parties and all that, which he must be, you all must be, you're young. So the idea is to have half the meal at home.
Yeah.
So that
That's
you
right.
can nibble from salads and this and that. But this is what the Hollywood actors and actresses do to maintain themselves. So that is one advice I would give you, that, do that. And for me, when they stopped inviting me, And I was very happy because I was happy being alone. No, I'm kidding. So go ahead. Next, anybody else? I would love.
Thank you, doctor.
No, not at all.
Do we have any other questions?
Don't be shy.
Yeah.
Please read my book and please write a review.
Yeah. Well, we do have a lucky draw.
Wow.
Yeah. Dr. Sethi has to go. That's totally fine. Sudhir will catch you later. So what I'm going to do is share my screen of what's a spinning wheel.
Wow.
All right. And I have everybody who joined us, and regardless of, if they're not anymore on the Zoom call, it doesn't really matter, but I took down your names and we're going to start. We'll do a spin and we'll do 2 spins and we'll find 2 lucky winners who Dr. Taher is willing to send his book to. All right. Ready? Yeah, Sudhir, and he just left. Okay, so we'll take his name out from the second spin and we'll get his address for Dr. Taher. And ready for the next spin. Oh, well, I should be resetting it. Okay. And go.
Shraddha Jain.
Awesome. Okay, so Shraddha. So Dr. Sudhir Sethi and Shraddha Jain are our 2 lucky winners for today. Guys, we will reach out to you, or please feel free to reach out to either me or Raj and send us your complete mailing address so we can hand it over to Dr. Taher and he can arrange for the books to be sent to you. Well, thank you so much, Dr. Taher, for joining. Do you have any final words, any final message for our participants, either here or those who will be watching this recording later on?
All I can say is let's work together on this. I need a lot of participation from all you people to really get this heart healthy message around, That's all I care. Even my book sales are all going to charity. So I'm not interested. I just want to leave a legacy that we should not be dying prematurely. That's it.
Yeah.
100%.
Raj, do you have concluding remarks before we wrap up and close this event?
No, this is, thank you for taking the time, Dr. Taher. I know this month is Heart Month. It's Valentine's Day on Monday. So definitely not only think about your loved ones, but think about your own heart and other people's hearts, and eat well, be healthy. And if we can take a few of Dr. Taher's words of advice and implement them, I think we'll have a great step forward in our lives and lead a more fulfilling life and just keep going.
Absolutely. Great.
Thank you, Raj.
To all our participants, we will see you on LiveMAST, Whole Food Plant-Based Support Group. Yeah, we'll continue the dialogue there. Thank you so much, Taher. Thank you, Dr. Taher. Thank you so much for joining, everyone. Bye.
Bye-bye.
Thank you. Thank you, Nivi.
Bye.
Thank you.
Thank you.